Welcome to Beyond the Data. I'm Dr. Phoebe Thorpe, and here with me today is Dr. Goetzel from Johns Hopkins Bloomberg School of Public Health and IBM Watson. Thank you for joining us.
Thank you for inviting me, Phoebe.
The session today was on workplace health. It was really interesting. We heard a lot about workplace health and a lot about worker safety. Of course, it's important to keep workers safe at work. But your expertise is more in workplace health promotion. Are these really different?
They're not really different. You can think about a workplace as a place that should be promoting the health and well-being of workers and obviously also promoting their safety. You don't want to work in a place that is unsafe from a physical standpoint or even a psychosocial standpoint. So those are absolutely the essentials, and that's what total worker health is all about. The interaction between health promotion, disease prevention, and occupational health and safety, they have to travel together. They have to be a combination. You can imagine workers in a workplace, and you're trying to get them to quit smoking, but they're being exposed to toxic chemicals or odors or things that are really not very supportive of their health and safety. You can't ask them to do that if the work itself is toxic. So these have to be traveling together. Occupational health physicians need to be focused on chronic disease prevention, and things that people do, both at work and also at home, can influence their safety. Imagine people who are obese, or people don't have a proper diet, or don't get enough physical activity. They don't feel fit, they don't feel strong. They have high blood pressure that's uncontrolled, high cholesterol. They may be at risk for diabetes. These things really do influence your health, well-being, and safety at the workplace. So these things need to be traveling in parallel with one another.
Yeah, it's the safety, health, and well-being that I really heard in the session today. You had mentioned that you have a secret sauce as a way to kind of improve the workplace health culture and make it more healthy. Can you tell me about some of those?
Sure. So my team and I have been studying healthy workplaces for about 3 decades now. So we've had the luxury of going out and visiting many of the companies that have done this well. Many of those companies, by the way, have won the C. Everett Koop Award, which is an award given each year to organizations that can document that their programs have improved health and also produced a business purpose. They're, in many cases, a positive return on investment for their workers, and often that includes safety interventions. So I've traveled around the country, I've talked to people, I've talked to CEOs, I've talked to workers, to various people running these programs, and we have come up with certain themes that define best practices, as you call it, kind of the secret sauce for best practices. So let me just name a few things that we have discovered over time. Number one, you've got to have these programs embedded within a culture of health. It can't just be something that's plopped down or parachuted down on workers where the announcement comes out and says, well, tomorrow we're going to have healthy days. It's got to be part of the culture, part of the environment, part of where people are. In fact, one CEO told me, I want my workers healthier and safer at the end of the day than when they first came in. So culture that is there, its benefits, it's all the things that are important to create that culture. It's a way of being, not just a program. Coupled with that is senior leadership and commitment. And it's not just the CEOs and the C-suite people, but it's also the middle managers, the supervisors, the people who have day-to-day interaction with their employees. They have to buy into it, they have to support it, they need to see the value of having a healthy workforce, and those are kind of the key elements up front, and there are many other things that they do.
Can you give me another example?
Yeah, one other example is having clear goals and objectives to your program. In other words, you can't really expect people overnight to become healthy. They can't overnight start eating healthy, start exercising, quitting smoking, managing their stress. These are lifelong habits that have taken a while to get to where they are, where they're problematic. So why not set goals that are intermediate, things that you can accomplish in 12 months, in 24, 36, and then eventually down the road, you're going to get to those things that matter to the organization and to the workers themselves.
The other thing that I remember from your presentation was about evaluation, because that would be helping you know that you are moving towards your goals. And then there was some about incentives, but that seemed a little bit tricky about incentives. Can you speak a little bit about that?
Sure. Yeah, I'll start with incentives. Well, I call them smart incentives. So there are a lot of dumb incentives out there, and I think many of them are actually counterproductive. The idea behind them is that if I pay you enough money, you're going to stop doing something that's pleasurable to you. For example, you're going to stop eating food that you shouldn't be eating, or you should stop smoking, or you should doing those things. And in some cases it works, but to some degree, but people are very suspicious about being paid to do things that ought to be good for them. You know, why is somebody telling me to do something that actually I should be doing on my own? So internal incentives are very, very productive, figuring out why people want to be healthy. And that's one of the key questions that I ask right up front. You know, why do you want to be healthy? Well, what's in it for you? And then bringing incremental incentives into place. So I'll give you an incentive to participate in the program. I'll give you an incentive for making progress, and I'll give you an incentive for moving along, but it may not always need to be financial incentives. In fact, when the money amounts get too high, they may actually be counterproductive, because people say, well, why are they paying me all this amount of money to do something? There must be something in it for them. So minor incentives to get your attention, to get you engaged, and to convert those external incentives into internal incentives is what works.
So the other question I have, that because I hear incentives, and I would think if I was a small business owner, I hear ka-ching, ka-ching, lots of money. I'm wondering, are there incentives or health promotion things that can be done that don't cost a lot of money?
Yeah, indeed there can be. So imagine an incentive might be having lunch with the CEO, or going on a walk with some of the senior managers, or having your success be publicized in a newsletter, or getting an award or plaque or your name up on the wall for doing things that are helpful, and actually helping other people is an incentive in and of itself. So there's a lot of evidence out there about volunteerism. So people who are engaged and involved in productive activities and helping other people become healthy, those are built-in incentives that they feel proud of. So it doesn't always have to be money. Sometimes you need a little bit of money to get people's attention. Okay, why should I be doing this? And other ways to get people's attention is by offering them a richer benefit plan if they participate in the program. So essentially they get a better plan for the same amount of money, and it can be organized in a way so that it's cost neutral for the employer. It doesn't actually cost them any more money.
And then we were discussing also about little things that you can do, like making stairwells open. And what are some of those that would increase that healthy works?
Right, so a lot of things that employers can do actually don't cost a lot of money. It gets very expensive when somebody is ill. So if somebody needs treatment, if they need medicine, if they need an operation, if they need a procedure, all those things, that's where the expense comes up. And the idea is, of course, to prevent them from getting to that stage in the first place. So if somebody is pre-diabetic, or if somebody has metabolic syndrome, they're not quite very expensive yet, but they will be unless they move in a healthy direction. So getting people to eat healthy, why not in the cafeterias and vending machines lower the prices of healthy foods, increase the prices of unhealthy foods? If you want people to be physically active, open up the staircases next to the elevators, encourage people to use the staircases, even mark hallways, put little mile markers there so that people know that they're getting certain certain steps every day in their lives, making the workplace the design of the workplace more amenable to physical activity and interaction. So there are many programs and policies that people can do to improve the health and well-being of the workplace and improve their safety, which don't actually cost a whole lot of money.
And you had mentioned the workplace scorecard as a place they could go to find out some more about those different ideas. Exactly.
So there's a free scorecard out there on the CDC website. It's called the CDC Worksite Health Scorecard. It was developed a few years ago. We're now in the process of updating it. It has 16 modules, and essentially it's a series of yes-no questions, roughly 150 yes-no questions, things that you can do as an employer to improve the health and well-being in general, in terms of organizational support, but then in specific categories, anywhere from lactation support to occupational health and safety, blood pressure, cholesterol, all kinds of different topic areas. And essentially, they're evidence-based practices, programs, policies, environmental supports that all employers can be doing, and many of them are actually no cost to the employer.
That sounds like a great place to go for ideas. The other thing that got released with our session was the new website for workplace health. Can you tell us a little bit about that?
Right. So there's always been a call for a central repository, essentially a clearinghouse for the best resources that are evidence-based, that are vetted, that are credible resources that employers can go to. I mean, there are lots of different places. If you Google workplace health, you'll go all kinds of places, some of which are commercial, some of which are government-run, and there's some of which are actually not very good. They may even be harmful to workers. So this is the CDC's work at getting all the vetted and credible resources in one place, organized in a systematic way so you can assess the needs of the workplace, you can plan, design programs, you can implement programs, and you can also evaluate these programs. So they're all organized in different ways. There are organizational risk factors they're sitting there, all kinds of tools and resources, things you can go to directly without being directed to other websites. And then it covers all the major risk factors that employers should be addressing. And it tells you with specific concrete recommendations what you can be doing to improve the health and well-being and safety of your workforce.
It sounds like an excellent place to go. And I know in the session they talked about a special area for small business. They have a call out for that. So I would encourage them to go there too.
Indeed, yeah. I mean, the large businesses, they have the scale, they have the resources, they have the people, but even small businesses can do that. If they carve out people's time and make it acceptable to have people focus on this and have wellness champions and wellness committees. But I've seen small businesses with as few as 500 workers have as many as 4 different people dedicated to health promotion and wellness in the workplace. And these businesses are spending the money and they're getting good value on their investment.
Yeah, that's important too. Thank you so much for joining us and for your expertise. It's
You're
much
quite
appreciated.
welcome. Thank you for the invitation. Appreciate it.
And thank you for joining us for Beyond the Data. See you next time.